Happy Wednesday, everyone. This is Dr. Sean McWilliams, and welcome to Back Talks. Hey, if it's your first time here, welcome. So nice to have you here. If this is your 110th time here, welcome back. It's so great to have you part of our family. Hey, drop us a line. Say hello in the comments, please. If you have a question, I want to answer your questions for you today in the next few minutes. If you're a mom and you're dealing with chronic neck pain or back pain, if you're being told that the only option for you is to have surgery, you are at the right place, because I want to give you some guidance and hope and hopefully some inspiration that you may not need that. So make sure you say hello, please, because I want to be able to answer your question. I got a couple ways that I try to see that for everyone as well, so just keep that in mind. And so let me just make sure that we are live on everything here so that I can answer your questions for you. Let me just refresh all of our stuff. So, all right, I see us live on Facebook here. Let's make sure we're good on YouTube. All right, we're live now. All right, we're in business, so I should be able to see your comments. So I don't always see them on the hardware that we use. It's not perfect technology, but let's get on with it. So, are you a mom in your 40s or 50s, with children, and you're struggling with back pain? Well, if you are, you're at the right place. I want you to know that, and I want you to leave today feeling more peaceful and more calm. Are you being told by your surgeon that you absolutely need to have spine surgery to manage your chronic neck pain or back pain, and you're like, I don't want that. Show me non-surgical options. If that's the case, you're at the right place as well. And why do I say that? Well, let me show you this. Here's a mom saying, I should have never had back surgery. And one of the things I want you to see is, between 10% and 40% of patients experience failed back surgery syndrome. Well, what is failed back surgery syndrome? Well, it is now an ICD-10 code. So when you go to a doctor's appointment and they are trying to figure out what's wrong with you, they have to do a thing called diagnose you in the medical world. What's wrong with you? And so there's all these terms, and there's a very large list of them. And now surgeries that have gone bad, called failed back surgery syndrome, is now an ICD-10 code. That only happens when it's happening on a quite regular basis. I don't want that happening to you, okay? So please understand, 10 to 40%, that's a lot of patients experience failed back surgery syndrome. And the other thing that I want you to see is, I want you to see this. Reoperation within 3 years is 4.5%. I actually think that number's higher. That seems kind of low to me from all the research I've read and seen. Chronic pain persists in 15% on average of patients. What's that mean? That means if you get a back surgery, you have a 4.5% chance of having to get another one done in 3 years. Again, I think that number's higher than actually it is. And you may have chronic pain that persists for the rest of your life because of it. And you don't get that with doing spinal decompression. So I want you to know that, okay? And if you're with me and you're saying hello, please make sure that you say hello. I would love to answer any of your questions for you. I am just trying to get this up so I can see them. And come on, Facebook. So what do we want for you? Well, I want this for you. I want you to have natural relief. I want you to have natural relief from your chronic neck pain or back pain if you're a mom, without surgery that's dangerous, without dangerous addictive drugs as well. And we created a course to help you do that called Disc University that we're really proud of. And so, why do I bring this up? Well, I bring this up for one main reason, because I want you to realize that spinal decompression probably has the highest success rate of anything that you can do when it's done correctly and when it's done by people or taught to you by people that actually really know what they're doing. Hey, Marisa, great to have you here. And so that's really important. So I want you to see this study from Dennis McClure. So Dennis McClure was a neurosurgeon, not just an orthopedic surgeon. You know, you got orthopedic surgeons and then you have neurosurgeons. It's kind of the way this works. And, you know, Dennis McClure was kind of getting tired of doing surgery on people and seeing the success rate with it. And he wanted to see, was there another better, more positive outcome and option that was nowhere near as invasive or dangerous as doing surgeries, especially with bulging discs and herniated discs and spinal stenosis and facet arthropathy, four most common things that usually cause chronic back pain. And let me show you one of the studies, you know, let me show you a study that he did. This was 1,200 patients, by the way. This wasn't like 10 people. This is 1,200 patients in his practice. And out of those 1,200 who he chose not to do surgery on and to do computerized spinal decompression, 86% of them had improvement of their mobility, their ability just to move and walk and bend and twist. 86% improvement of people's pain scales. 86% improvement of activities of daily living. And what's that mean? Well, that means that you can wash yourself, you can take a shower or a bath by yourself without pain. You can bend over and wash dishes in your sink. You can load the dishwasher or unload the dishwasher, put cabinets, you know, put stuff away in the cabinets. You can do laundry without being in chronic pain. Those basic things. You can go for a walk and do the stuff that you love to do. Maybe go on a vacation. All right, so activities of daily living are your basic things that we do throughout the day. And can you do this without pain? Well, yeah, I mean, 86% of the people had almost no pain and had improvements in all of those things. It's huge. And 76% of them were pain-free after a year of doing this. You know, in our clinic, you know, and the reason that I created Disc University is, you know, we had an 88 to 93% success rate for our patients, non-surgically. And I want that to happen for you. I don't want you to get cut open and get rods and bolts and stuff in your spine like if you were with us last week you saw. I don't want that happening for you. I want you to have a non-surgical approach that helps you heal your body from the inside out. It's the whole reason I spent the last 2 years of my life creating a course to help people all around the world. And now I get to help people all around the world. But if I'm not helping you, it doesn't matter. I want to be able to help you. I want to help you come back to be the mom that you were and that you've always dreamed of being. And that you can play with your children and you can go on that vacation that you probably put off because you're afraid that your back's going to hurt you too bad, or your neck. That you don't make dinner like you used to, and you just dream about creating a really awesome dinner. I just had it with one of my patients, you know, to make her husband his birthday dinner was one of her dreams that she wanted to do, and she was able to do it. And that's what this is all about. And she was actually considering surgery as well before we talked, but she knew me and she knew the success rate we've had and with her brother, and it's just so nice to see her living her life and getting back to work full time, which is great, without living on addictive drugs and painkillers and opioids and things like that. So that's what I want for you. And so, you know, I want to show you just what you can do from the comfort of your home. This is a pre-MRI of a patient of ours. You can see there's a big red area right there with the red arrow, that big black blob that's sticking out. That's a herniated disc without getting too technical about it. This person had chronic low back pain going down their buttocks and legs, sciatica. You know, if you have that, how painful that is. Was losing strength in his leg as well. Was having a very hard time getting to work. This is his transformation, where you can see that red line. You see there's no black blob anymore. This is the same patient 12 weeks later after doing non-surgical approach that we taught him how to do. And this is what I want to have happen for you. I want you to get where your spine is healthy, because if you go to a surgeon, they're usually not going to do a post-MRI and show you how healthy your disc is. They're just going to go in and see if they cut out the right piece. And remember, you know, the disc and the tissues are still in a disease state. That's usually why they got there to begin with. and I don't want you having to continue to live with diseased tissues inside so that you're dealing with, in 3 years down the road, another surgery. Because you don't want that at all. And so I hope that inspires you. That's a real, I try to show you real scientific proof, not just my own opinion, but real scientific proof of real patients of ours, beginning phase, 12 weeks later, and the miraculous miracles that can happen for you by doing spinal decompression at home when you do it correctly and you go through the protocols and steps that we teach you how to do, and you can do it from home. So I want to give you a tip today, and so here's a tip I want to give you, and it's, believe it or not, it's on icing. It's one of the most common things that I see a lot of people do incorrectly. So let me show you how to do it correctly. So here's a great position. If you're in low back pain, this is going to typically create the least amount of pressure into your low back discs. And it's also a great position for you if you're having neck pain as well, as long as you're comfortable that way. You want to get a great ice pack, and you want to ice your spinal area for 30 minutes. So if you don't have a great ice pack, and you got one that's kind of mediocre, then I want you to use 2 of them. So you want to get one, put it on the area for 15 minutes, and then get someone to bring you another one and swap it out for 15 minutes so that you get a full 30 minutes of icing. Throw them back in the freezer for an hour and a half. Don't let them warm all the way up, or they take like a day for them to chill back up a lot of times properly. And then in an hour and a half, I want you to swap them out, and I want you to do that same process again. And what you're going to start to notice is I want you to do this 8 times. I know it sounds like a lot, but I'm telling you, I've been doing this work for 30 years of my life. Once or twice does a decent job. 8 times does a miraculous job. If you've ever seen my back, when I injured it really bad, and it was black and blue, if you've been with me for a while, you remember that picture. I know it was gross. I was icing 8, 9, 10 times a day. And I'll tell you what, it made such a difference for me. And I'll never forget that. And that's why I tell you this. So that's what you're going to want to do. And this position for your low back reduces the most amount of pressure on your disc. So it's usually the most comfortable for probably 90+% of the people. Okay, so I hope that helps. And that was kind of my tip of the day if you're dealing with chronic neck pain or back pain. 30 minutes of icing, 8 times a day, please. You know, if you're looking for some guidance from someone on how to manage this, you know, things have changed. People are looking for online ways of learning how to take care of themselves and not just constantly being reliant on a doctor and going to a doctor's office and appointments. I just hope that, you know, if I show you this slide, it'll give you a little bit of understanding of you know, what I've done for you. You know, we worked really hard over these last 30 years to be the best in the country, and in 2019, 20, and 21 we were voted one of the top spinal decompression doctors in the United States. And I only share that with you is to give you some confidence, to let you know that this isn't something that I dabble in. You know, I made a decision not to be a generalist and be a specialist when it comes to the spine. I teach doctors all around the United States and the world on how to do it, and I help moms just like you. I have people all over the world right now who are getting back to their life without having to take, you know, constant medications and constant, still be in pain, or maybe have failed back surgery syndromes. We want to do it non-surgical, and they start feeling like the mom. You start feeling like the mom that you know you're always meant to be. And so if you'd like to talk, I would love to talk with you. If you're looking for a different opinion, a second opinion on your x-rays or your MRI, I would love to give that to you as well. I'm doing a complimentary right now. I know I don't have to do that. A lot of people pay me a lot of money to look at their stuff, but I'm on a mission to change the way that we manage spinal pain here in the United States and around the world, because surgery should not be your only option. Spinal decompression has amazing statistics and amazing success rates for moms and dads all around the world. And I would love to share that with you if I think you're a good candidate for it. But I would love to shine some light and hope into your life and help give you some guidance and direction. So if you would love to do that, I invite you to go to booking.drshawnmcwilliams.com, where you can get onto my calendar, and you can fill out a little form and let me know everything you've been dealing with, what you've tried so far. Do you have imaging? Have you been taking medication? Have you had any surgeries? Are you doing therapies? What did you do? Did they work? Did they not work? Where are you at? And where would you like to be in 12 weeks from now? And then you can find a time on my calendar where I have some openings, and you and I will sit down on a Zoom call and say hello for 15 or 20 minutes. And I'll listen to you, and I guarantee I will shine some positive Dr. Sean light in your life and help guide you. And if I think Disc University would be a great fit, then I would love to show that to you, and I would love to show you the success of it and how easy it is to do, and help you get your life back and get out of pain, no matter where you live in the world. So thanks for being with us today. It's always a great pleasure having you here. I'm a one-man show behind the camera, so I'm always looking to just bring you the best information that I possibly can, as I'm looking at 5 different screens right now. So it's not that I'm not paying attention to you if you're with me, just trying to make sure that I answer any comments or questions before we get off. So that's what I'm doing right now, if you're wondering. And I just want to make sure that on YouTube, if anybody's here, that we can I can make that happen for you. And if you have any questions, and you're on Facebook as well. So if not, I hope that this brought some light into your life. I hope that perhaps you know somebody that isn't icing and heating and doing the wrong thing. So I hope you'll share this video with them. And if you liked it, I hope you'll subscribe to our Facebook page. Leave me a comment. Tell me what you think about it. I'd be really interested to know if you've been dealing with back pain, and if you have, what you've been doing, and perhaps maybe what's not working for you and how we can help you. And also, if you're watching us on YouTube, subscribe to our channel so that you can help share this message. Hit the notification bell so that way every single time that we do something that's brand new, you get to know about it first. But most importantly, if you're the one suffering or someone else is, have them go to booking.drshawnmcwilliams.com and get on my calendar. And do it right now. Don't wait till tonight. Don't wait till this weekend coming up. Go sit down at your computer right now, or your phone for right now for 5 minutes, and set an appointment up with me so you can stop suffering and start having some hope and inspiration and joy back into your life, realizing that you're not alone, and I understand what you're going through, and see what we can do to help you without surgery and without drugs. Okay? All right, guys. Always great having you here. See you next week.